talked in your acceptance speech, you spoke about public health officers not being afraid to speak out. What about this report required courage to produce and communicate?
Well, it is a very challenging subject. First of all, it's new in the sense that we have often, like 30 or 40 years ago, people really didn't think very much about the environment and industry, and there has been a lot of work done on that front, and now it's accepted that we need to do environmental impact assessments. But the concept of adding the extra dimensions of health into that and looking at end objectives of having healthy people and healthy communities is relatively new. So there's a challenge of communicating new ideas. Secondly, it is a sensitive matter, and there's a lot of people with very strong opinions on different sides on this. And for a public health professional, our role is to provide advice, information, communicate, and yet not take sides. And so we have worked very hard to remain neutral and keep the middle ground. And of course, in doing that, you make nobody happy. So you have challenges and from both sides. So personally and professionally, it's hard to keep the course.
What do you think was the most controversial aspect of your report?
Well, certainly there was a discussion as to whether this should be brought into the public domain, and that is something that we had to address and was addressed. And I think that the award recognises that that was an important thing to do. So that was controversial. I think the ongoing controversy around it is trying to make sure that the recommendations are implemented and that attention is paid to them. I still believe they're very important. But I would like to think that this document is actually larger than just for the question of shale gas, because really what this is a document is how can we address the problems that are arising with industry and finding a balance between keeping the health of the environment and the health of people at the forefront of industrial development. And I think that there has to be a way found forward, because the current climate is not conducive to either health or to industry.
Take us behind the scenes for a minute. When the current government we did not get the sense that this report was going to be made public. What did it take to get it out there?
Well, there was a lot of public support. This document was led by me and my staff, but it was done in collaboration with many others in the province. And while we hadn't done public consultation, and that remains a key recommendation, we had worked with a variety of people. So people were aware that the document was being developed, and so there was a lot of public support and a lot of support from media to have it available, because it was felt that there wasn't really a lot of information available to inform people on the subject of shale gas, and so I think that was the public pressure and support was a key factor, in my opinion.
As you watch the protests that are taking place, in fact, people getting arrested over shale gas exploration and the development of the industry, what is your personal reaction to what's taking place?
To be quite frank, I find it upsetting. I think that it's personally, I don't like to see conflict. Professionally, I think it's an unhealthy situation. Increasingly, we are understanding the links between anxiety and moral distress and the association with disease. And so I think that is why in the recommendations we have made many recommendations about trying to find a collaborative approach so that these types of situations don't arise. The fact is that in our review of developments in other areas, this type of community stress was a common finding, and so in my opinion this situation that we're seeing now is predictable, and it would be good to see some resolution brought to it.